Speaking with us now, Dr. Bruce Culleton, the Chief Medical Officer with CVS Kidney Care. Good morning. Thanks for your time.
Thank you.
And you just wrapped up a very important speech here with the ASN community. How do you feel it went?
I think it went pretty well. Some good response, a lot of excitement after the speech.
And specifically, your talk was focusing on the care delivery methods and how sometimes that might need to change.
Yeah, so I spent a little bit of time talking about technology following Dean Kamen's speech. And how important it was that technology is an enabler for care delivery change, but care delivery change also needs to incorporate physicians as leaders. Physicians in particular, in this case nephrologists, need to lean in for change and work within collaborative multidisciplinary teams.
Is there a reluctance to implementing those changes? And if so, why?
I think to some degree there is a reluctance. Deep down, most nephrologists want change. They want to see change happen. They want better outcomes for their patients. But there's also system barriers and also just a lot of inertia. We've been doing the same thing for about 20 years. It's hard to change that.
You spoke about following Dean Kamen and some of the technology that he laid out. Anything in particular that excites you that you would like to see implemented sooner rather than later?
Well, we're working with Dean on a home hemodialysis machine that's specifically designed to help patients do their own treatments in the home. So we're working through the FDA to get that approved. That's not an approved device yet. But that's going to be one component of how we're going to support patients who have kidney failure in the home. We also think a very important aspect is to what we say move upstream. That is, how do we identify patients who have kidney disease before they have kidney failure? How do we slow that progression? How do we keep them off dialysis? Maybe get them a transplant if they need it. And also educate them along the way so that they understand how to help themselves.
Why do you think it was important to bring your message to the ASN community?
I think for the ASN, so some of the messages that we talk about as a company are not necessarily new messages. What's of interest to the ASN community is that it's coming from a different corporation that's not traditionally in the kidney space, and a large corporation that can scale ideas rather fast. So as you probably know, CVS, 10,000 stores around the country. We have a store within 3 miles of 85% of the population. 4 million people go through the doors every day. So there's a tremendous opportunity to not just improve awareness related to kidney disease, but also use a lot of our assets and capabilities to help with delivery of care.
For those in attendance of your speech today, and maybe for those who weren't there, what were the 3 main takeaways that you would like for people to focus on?
I would say the 3 main takeaways are we need to put the patient first instead of the dialysis provider first. We need seamless, multidisciplinary, coordinated care. And we need to think about delivering most of that care in the home where possible.
All right, Dr. Bruce Culleton, thanks so much for your time
You're
this
welcome.
morning. Appreciate it.
Thanks.